So one carry-home message that we can come out so far is that every healthcare institution will have to think of increasing communication as a strategy to prevent these problems. And that communication is not merely trying to give a theoretical thing of, verbal and non-verbal and all that is fine. I think even the introduction of scripted communication, trying to tell them as to what to talk, what not to talk, and to understand that all the members of the team, of the healthcare team, are important in understanding and communicating. I think we have to move now to the next thing that we can talk about is what, again, our friend highlighted, and that is the perception of cost, perception of an extremely expensive affair, and like what Sam said, our inability to take, I would say, unfavorable outcome as a result. I'm spending so much money, then I should be all right. And the media and the film, of course, plays a great role in somehow infusing this kind of a mindset that if I have spent money, then I should be okay. So I'll request our friend Ravikumar to say how to kind of again deal with this kind of a situation where the cost and the outcome is an issue.
Thank you, sir. I will share on 3 points on 3 minutes on 3 case studies. The points will be on precipitation, provocation, and prevention. And the case study is that 20 years back, I was called in the night at 10 o'clock for a patient who was in distress. I was the night supervisor. So I was talking to the patient in a single room. Patient said he came at 10 o'clock and he paid a lot of money, got admitted, but he's not getting chapati and sabji. So that was his complaint. I said that was a little easy complaint for me to handle. But what he did was, next was interesting. He opened the suitcase and took a pistol out. So he had a gun right in front of me. And what prevented the bullet was only the chapati and the sabji. So I think I was in a very difficult scenario. So that was that I had paid so much, I'm not getting what I need to as I arrive into the hospital. The second scenario was a patient from a northeast. Now I survived the bullet, so that's why I'm talking here by God's grace. The second scenario is a patient who came from northeast, traveled all the way, this again 20 years back, traveled long distance, came down with his child, got admitted in emergency department. 10 minutes the care was going on. Suddenly he became violent, he hit everybody. He broke the BP apparatus, broke the glass. So we didn't exactly know what exactly was happening that he is behaving like that. And we couldn't speak his language and he was manhandling. So security pulled him down and almost tied him. And then we had another doctor who comes from his place. So we had to ask him to talk to him and find out what happened that he was so upset that he was so abusive physically. Now again, that was a factor which precipitated because he didn't know the language. And there are many factors which he thought was not in favor of him, which I will share in the prevention. The third one, when I went for a Nepal earthquake disaster relief, suddenly we went to a relief of evacuating people, and there was a big crowd. We had a Volvo bus to evacuate patients and come down from a tribal area down to the ground level. A large gathering was surrounding us, a mob. And we were really worried. The advantage for me, I was cool because I didn't know the language, what they were scolding me. That was a plus point. But what happened was they thought we are all taking them to Delhi for kidney stealing kind of stuff. Now, if I go back to the pricing with the precipitation, in both occasions, nobody gets up from home and comes to the hospital to fight. Everybody comes for treatment, but the environment that we give in there is what makes the difference. The environment of the physical ambience, the environment of your approach, the environment of your communication, the environment of how you make them feel that you are cared. You think you are caring for them without making them to feel that they feel they are being cared for. And I know a patient who was asked 20,000 to pay. He went out to get the money. By the time he could come, the patient died. And he was very abusive. He threw the 20,000 in single money over the healthcare team. I said, get back the life of my dear one. So that was not something that could be. How do we prevent it onto that? Identify the cues in which the patient can show manifestation of anger. So this is what we trained our healthcare team in the emergency department. They pick up cues so that they tell us early they're upset about something. So senior level people walk in, intervene, talk to them, find out. Because sometimes 2 lakhs to be paid for advance. Where do you? ATM has a limitation of the money that can be drawn. So you can't give 2 lakhs or a 1 lakh to be paid at that time. So yesterday we had a patient who had to pay 50,000. The doctors wrote it nil to pay. And it was told, donate 1 pint of blood and admit. They said no donation blood and went to another hospital. We pleaded with them saying it is totally free, but they were not happy because they don't want to donate blood. So many times, the economic factor plays a very significant role. As like Sir said, what is the expectation with which they come, especially when they come to a mission hospital. Government hospital, they go with the feeling it will be totally free. And when they go to a corporate, they feel, I'll have to go with a little money. But between the two stands, the mission hospital, they come that some amount will pay and remaining will be made free. So inevitably, with that perception, it is the cue that pick up, it is the communication, your approach, your body language, everything matters in reducing. So that's why I call it 90% of the anger that the patient present or the relative present is preventable by virtue of your behavior.
Thank you, Ravi. We have to speed up, friends, because I think we're running late. So next thing is what I'm saying, you go to any gathering, you go anywhere, and if you start a topic on some medical this thing, invariably people will come out with something, boss, that you people are ordering unnecessary investigations, you were given unnecessary medications, so on and so forth, only to inflate the bill. And even to the extent that you kept this patient, he was dead already, but he was kept for 3 days more to kind of so that you can extract, money out of this, etc., etc. You hear this all the time. So I think this brings to the ethical issues in the profession. I'll request Dr. Venkatesh as to what do you think, is that contributing to anything in this regard?
Thank you very much. I should thank Dr. Lallu for calling me and asking me to speak on bounces for healers. So I was quite surprised when she told that, are we going to have this as a topic? And now I can see that it makes so much of sense. In fact, the first person I called up after hearing this talk, this topic was my dad, who is a pediatrician. He's doing 5 decades of pediatric practice in my native place. Many years back, maybe 35, 40 years back, one day he came bruised all the way. And my granddad came and he said, what happened? He said, no, I was attacked by a patient, a relative. He was one of the few pediatricians who were practicing at that time. So he said, keep a stick, rod, in your this thing. So I remember that still. So I called him up almost 40 years later now. I asked, Dad, are you still keeping that stick? He said, yes, I'm keeping a stick. Are you using it? So I said, no, but I have a bouncer now. No, I'm not joking. So he said, who's the bouncer? I've never seen him. You must have seen our driver. Yeah, he is a professional bodybuilder. So he's still using that because he's getting threat from patients. Treating patients is so difficult, they say. So then it made me to wonder why, like as he said, no, there are certain things, no, nobody comes to fight with you. So why you really think that they are going to attack you? You also never think that this patient is going to attack you. And many of these patients who come and attack you are very meager patients. They never thought that they will come and hurt you. And we see this quite often in spine practice. Because the communication is that there are certain things which they would like to hear and certain things which they don't like to hear at all. And there are many ethical considerations on these things. Like, do you have to tell those words or do you have to really tell what is not possible? So maybe the like to hear words are, they'll say, like, you will be all right. As soon as you come to a doctor, you want to hear that word, you will be all right. But what is the ethical consideration? Are you really doing an ethical practice by saying a cancer patient or a patient whose spinal cord is totally cut, saying that you will be totally all right? So maybe we have to modify our way of telling it. It's not, rather than saying, no, you won't be all right permanently. Other thing is, they want to always hear there are no complications, obviously. It is not possible. Even if you take a dose of paracetamol, okay, my dad used to say, if a drug doesn't have a side effect, it doesn't have an effect also. So it is as good as that. So how to tell this to the patient is a big consideration. The next thing is whether they want to say 100% cure with an affordable rate, especially when they come to a mission hospital like that. So where they don't want to pay 100%, but they want 100% cure, also is expected. Then get back to your normal life. And the last worst thing is they expect is, and you will be happy ever after my treatment. So not only you, all your family and everybody. So the ethical consideration comes where we feel that whether we have to describe all the complications in day one when the patient comes to you or the relatives pertaining to your treatment. Say, for example, if a patient comes for an elective total knee replacement, which is a very simple surgery, are you going to tell the patient and relative there is a 1 in a lakh chance that you will die? And if that happens, unfortunately, what is going to be the response? They can blame you. You never told us. Because it's such an elective surgery, even if you have told 1 in a million, I would have refused that one. But if you keep on telling those things, we will lose patients. And they will also lose their chance of becoming all right. So it is a big question. I don't think no ethics can answer this, whether how too much to tell. Bad news during treatment. When you have explained the complications, they have a selective deafness specifically for that one complication, and they will close their eyes and ears for that. And when that happens, when you go and tell them, even though you tell, surgeons would have faced that. Yes, I have told it in the consent form. You see, you have written it. No, doctor, but I didn't expect this from you. So, and there will be a problem. So, I think the thing is what to tell, how much to tell, whom to tell is the ethical consideration here.
So I think you have very nicely highlighted that ethical issues are there, and which sometimes the professionals are finding it difficult to kind of overcome or something. We need probably much more than a small discussion, mainly totally on ethical issues and how to kind of handle those ethical issues and how to overcome, I would say, this mistrust based on the ethical issues between us and the community. Now let's talk about this has all happened. Now the issue is this: no matter what you have done, you are now gone into this. The hospital is facing a problem. Now, to start with, I'll request Dr. Narendranath. They have worked out a kind of a thing, especially in the city of Bangalore and Karnataka, some model, which I will want him to share with you, what you have done so as to, when you are subjected to this, at the moment we are not talking, we are at that time not in the stage of preventing it, it is happening. So please.
Thank you, sir. If you look at why, because the dengue epidemic and the H1N1 epidemic, where the case fatality rate is high, and that is the time people got together because they saw kith and kin dying very instantaneously. And that is the time most of the patients and patient relatives went into this kind of violences. Second, it was media highlighted, and it was a biased reports by the media, and that created problem. But we need to put up preventive measures at the institutional level. I think that will be spoken. We can have surveillance cameras, we can improve the communication skills, but still there are chances of getting violated. So we need to have a regulation, enactment. When we face this kind of problem, this was basically between 2013 to 2016, a lot of incidents occurred, especially in Bangalore and Karnataka. What we did, I think Private Hospital Association and Nursing Home Association, which is quite strong body, could coordinate and bring all the professional bodies together with Dr. Alex is here, with AHPI, IMA board came together. Luckily, we had an act to prevent violence against health professionals and hospitals from 2009. But unfortunately, the police will never book a case, even if you complain. The moment the hospital goes and complain to the police, they will instigate the patient party to book a case against the hospital for medical negligence. So automatically, the support from the police will never get for the hospitals and healthcare professionals. And this is the common experience in Karnataka and Bangalore. So what we did, we all came together, Pana, and one day, about 10,000 doctors came onto the street in Bangalore, took a march to impress upon the Home Minister and the government, see that the law is implemented in its true sense. Dr. Alex is here. He himself, along with few of us, went to the Home Minister, impressed on him. In fact, he came and addressed all our gathering, and he promised and assured that this is going to be implemented strongly, and the direction came. Even after that, to get an order, the notification, to send it to all the police stations in the state, it took almost a year. And now we have an order from the police commissioner or the DCPs of that zone, a notification which can be displayed in the hospital, that any violence against healthcare professional or hospital is a punishable act. And it amounts even to imprisonment for 2 years or so. But still, we didn't stop there. What we did is we created a crisis management cell from the Private Hospital and Nursing Home Association. The entire Bangalore is divided into 7 zones as per the police. So what we did, we created each zonals. And each zonal group was created in the WhatsApp group. Whenever a hospital get affected, so what we did is the zonal coordinator will also tell other hospital nearby, and they go to that hospital. First is, of course, we may not be able to prevent the act, But what we can do is to give the moral support to the owner or the healthcare doctors. And we did that, and this is what we did practicing in last 7 years. And now we want to bring an app which says panic button. If there is one panic button which goes automatically to the crisis management zonal coordinator, and may it can get escalated to the deputy commissioner of police or even up to the higher levels. So we are working on it. But what is done is, with this kind of joint efforts, the number of incidents have come down. How we have also started recording these incidences and also analyzing the root causes, why this is occurring. There are some incidents where hospital is also a root cause. So we need to identify and tell them they should not do some unethical practices which people perceive. At least we should portray that we are practicing ethical guidelines and will not get into that kind of. So this is the effort we have done.
Thanks, Dr. Narendranath. I think this crisis management cell is a great idea, and I think AHPI and IMA should kind of take it forward to, I think, implement it across the country. This is the need of the hour, and they will also get a lot of, I think, benefit from taking this up. I'll request Dr. Ramesh Babu that now where this kind of a crisis management cell is not present, and you are a standalone small hospitals and the problem you are facing, what can you do?
Yeah, thank you, sir. If you face it in a hospital, what now the latest one is about code violet. So it is in rhyme with violence. So if you like code blue, code red, it's code violet. So if something happens at the reception or in the consultation room, you say code violet, it is immediately for all the employees to gather at that particular place. So that if there are 5 people making a nuisance, then there are 100 people coming together, definitely the effect will come down. That's the idea. But unfortunately, I'm telling you, this we tried in our hospital as an example. We tried to do it in our hospital. About 100 people were present, but none of the doctors was present. That is the problem here. No, not even a medical officer was present there, because it is there to protect them, and they were not present. That's a very sorry state of affairs, but now things have improved. In the beginning it was like that. So if you do that, definitely 100 people will come and stand. You don't do anything, you just come and stand, that's enough for the effect to come down. So this is how individual hospitals should do. Definitely, as we already suggested, that another thing is about the public relations. How you move with the police, that is also equally important. Your area police, you should have a good relationship. If you have a wrong relationship, definitely they will not budget. They will not even come there. So that is one relationship. Another thing is, one of the commonest things we have seen is the employer-employee relations. If the employer-employee relations, that is the management and the employee relations are good, then definitely you will get the support of all the employees. But if the relations are strained or some weak, definitely if something happens like this, nobody will be there in the seat. They will be just clicking the cameras and taking photographs.
And send it on WhatsApp.
Send it on WhatsApp. This is what is going to happen. So your employer-employee relations have to maintain. These three things we can do as an individual hospital. Thank you.
Thanks, Dr. Ramesh Babu. And in the end, I will say last 2 minutes, I want Durai Jasper to talk about how do you handle media under such circumstance?
Handling the media, sir, is one of the most difficult things. Unfortunately, they like to carry news that is not true. So a typical situation which I experienced, there was one situation where a lady dies because of PPH, and so it's very unexpected. She came in well, the delivery happened, the baby is well, the mother has died. Now, our security personnel at that point of time were involved in one foolish move, and that is they prevented the media people from coming near the point. Just because they were prevented, they had no clue as to what happened. So the next day's newspaper has flashed it saying, Durai Jasper, the PRO, was involved in bargaining with the patient relative. They said the medical superintendent or none of the administration was there at the spot. The fact was the director was there, the medical superintendent was there, everyone was there, but they did not see it. Now again, as far as public relations is concerned, one of the best things that you should do is, when you don't have an act in place like in Karnataka, keep the police in good books. What we have done in our hospital is at least, renovated one of the police stations. The other police station, we have put in a UPS for them, which they were in the dark when there was a power cut. The barricades are all supplied by CMC. We do a lot of good things for the police. We also do medical checkups for police people from time to time when it is possible, and they're all in the good books. So any time the police is always supportive to our institution. So this is something that other hospitals I would suggest should take as a cue to help themselves.
Thank you, Durai. I don't think we can do justice to this topic in the short time that we have been allotted. So we have to really conclude. Sam, you want to?
I had a very small thing. So we had a home healthcare company that was across India, and it's interesting. In home healthcare, the number of attacks mainly to nurses, but also to doctors, has actually been quietly going up. I think it's an unknown thing, but you're seeing the downside of public perception roll up stronger there because you have no support system. In a home healthcare, it's one-to-one care.
Yeah.
So you have none. And people disappearing, lots of violence. So we're seeing what can happen in the darker side. We actually had a doctor attempted kidnapping last year from an alumni of ours that had gone and set up a private practice, and 2 guys tried to kidnap him, thinking he was rich. Right? Of all the people you're going to kidnap, you don't do it to a pediatrician, specifically a neonatologist. So I think the public also needs some training.
So anyway, I
Sir,
would
just one point. I was going through the JCI literature. From the point of healthcare worker safety, there are certain accreditation standards prescribed. I think CAHO
Yes.
or NABS should think and create those standards, and which is practicable to Indian environment. I think that's the direction which we should.
Definitely work more on this particular topic and see how more can be done. Thank you very much. On behalf of my co-moderator, Bimal Charles, and all the panelists, we really thank you for enlightening. I know that this topic, I think one can go on for next 3 hours and then maybe come out with some kind of a white paper. But I think it would have really stimulated each one of us to think more about it, and let us kind of collaborate offline to do something more about it. So thank you very much. Thank you.
Thank you for that thought-provoking discussion on the safety of healthcare professionals at the workplace. I request the chairpersons to honor the speakers with mementos. Krishnan. Dr. Narendranath. Mr. Sameer Mehta. Dr. Ebor Jacob. Mr. T.S. Ravikumar. Mr. Durai Jasper. And Dr. Ramesh Babu. I now request Dr. Vijay Agarwal to honor Dr. Bimal Charles with a memento. I request Dr. Bimal Charles to honor Dr. Vijay Agarwal with a memento.
We'll all give it to you, Vijay. Come. We'll take a group photo. Come.